And welcome to the Windsor-Essex County Health Unit's media briefing on Thursday, February the 10th. Today we are joined by a couple of guests we have here today, two Windsor-Essex County Community Family Physicians. We have the Chief of Staff from the Hotel Dieu Grace Hospital, Dr. Steen, as well as the President of the Essex County Medical Society, Dr. Mirage, joining us along with our acting MOH, Dr. Shankar Nessathuri. We will get our session started today with some opening remarks from Dr. Nessathuri. Please go ahead.
So colleagues in the media, thank you for joining us today. We have Dr. Steen and Dr. Mirage, and I'm pleased that they were able to join in the dialogue today. I'll keep my opening comments brief. I think it's an important public health goal to improve the vaccination rates of children from 5 to 11. In Windsor-Essex, approximately 40% of children have had their first dose and approximately 15% their second dose. The province has set the target at 70%, and it's particularly important to vaccinate young people because it not only helps them, it makes them less likely to get sick and less likely to be admitted to the hospital and less likely to suffer the most severe consequence of COVID, but it also helps break the chain of transmission. And that's also a very important public health and societal goal. So with that, I think that Dr. Steen and Dr. Mirage will be sharing a few comments. I'll pass it back to you, Ashley.
Yes, Dr. Mirage, if you have any opening remarks you would like to make, please go ahead.
Good morning. So as a family physician, we always have our patient's best interests at heart. It is an absolute priority to break the chain of transmission, and we know that one of the best ways to do that is to optimize vaccination rates in the community. Like Dr. Nessathuri just said, we are targeting 70%, so we have some work to do. We know for sure that vaccines help to break the chain of transmission. We know that vaccines reduce infection rates, and we know that they reduce transmissibility. We also know that vaccines are extremely safe and that the benefits of vaccines by far outweigh any risks. The best chance we have of retaining schools being open is to get the vaccination rate optimized. And as a physician, I continue on a daily basis to strongly encourage my patients to receive the vaccine because the benefits by far outweigh the risks.
Thank you very much for that. Dr. Steen, if you would like to add any remarks.
Thank you. I appreciate the invitation to speak here today. As a mother and a parent, I definitely understand that this decision can weigh heavily on each one of us. But the science and the data, as we've spoken about, show this vaccine is safe and serious side effects are very rare. As a family physician, I would urge you to have that discussion with your trusted healthcare provider, because this is the person that you have already trusted with your child's vaccine since birth. They know your history, they know your child's history, and you can discuss your concerns, your questions in a very safe environment. This physician or nurse practitioner knows your child's health, and they have the long-term well-being of your child at the heart of the conversation. So I believe this puts the conversation into a very personal context for all parents. I believe, as both of Dr. Mirage and Dr. Nessathuri have already said, that it's very important to get this vaccine. We want to get our kids back to school, back to activities, to their friends and their extended family, while keeping them safe and protecting others as well. So I just appreciate the chance to add my voice to those here today, urging all parents to protect and vaccinate their children, our children, against COVID-19. Thank you.
Thank you all very much. And just also as a side note, we do have our CEO, Nicole Dupuis, and our epidemiology manager, Ramsey D'Souza, on the line should there be questions that fall into their realms as well. With that being said, we will move into our media questions. We'll take any questions from CTV.
Good morning. Just on that, so what is being done or what more can be done to improve the vaccine rate amongst the 5 to 11-year-olds?
Dr. Mirage, Dr. Steen, do you want to comment on that? And then perhaps I can supplement that.
So on an ongoing basis, as physicians, we continue to encourage vaccination in our specific, patient populations. And that would be an initiative that we take closer to home. The conversation is also now being expanded with, more media outreach being done. Again, emphasizing the importance of improving vaccination rates and emphasizing the importance of protecting the community. Highlighting the safety is an absolute priority as well. So overall, just raising the profile of this topic and trying to get legitimate information out there. And like Dr. Steen said, a huge part of this, I think the awareness is out in the community. I think people are acutely aware of the availability of the vaccine, and it's that conversation with a trusted healthcare provider that's going to make all the difference. So again, we encourage and invite you to speak to your healthcare provider. We encourage and invite you to use some of the resources that will be publicized with media outreach over the next few days and weeks, so that we can answer all your questions. And if we need to do it on a repeated basis to put your mind at ease, we are happy to do that.
And I would just add that I think with the partnership of the health unit, there are so many places now that people can go. I can tell you at Hotel Dieu, we have a clinic that is open to walk-ins, and in working at that clinic over the last 2 months, we have had a lot of parents bringing their children in. So again, I think going to places that are closer to home, where they can walk in, and making that availability, which the public health unit has been fantastic partner for us, supporting our ability even at Hotel Dieu to have a clinic for people in our jurisdiction, our area out here in West Windsor. Thanks.
Yes, so from a physician practicing on it with individual patients, I think the most important thing is dialogue. And for families and for parents that might have some reluctance, I think talking to your family doctor is probably the best strategy to improve vaccination rates. On a societal and a public health level, the Public Health Service is concerned about the health of the community overall. And I think that one observation is when one vaccinates their children, not as for a communicable disease, not only are you helping the child or the young person who's vaccinated, you're also helping all the other people in the community. Getting vaccinated is an affirmation of community participation and one's general affection for their other members of their school community and the community overall. In Ontario, the legislature passed the Immunization for School Pupils Act. It's a very forward-looking piece of legislation, which had a mechanism for young people and their parents to report the vaccination status of children, and also provided an opportunity for verification of vaccination status. It covers diseases such as polio vaccine. The reason that's important is that it provides some level of assurance that the majority of children in schools are vaccinated, and that helps them while they're school children. It also helps them in adult life. The Board of Health in Windsor-Essex has passed a resolution asking the province of Ontario to add COVID vaccination to the list of vaccines covered by the Immunization for School Pupils Act. I think that's a positive step, and I would urge the province to consider the advice of and consider that resolution from the Windsor-Essex Board of Health.
Thank you. And as doctors, how does it make you feel when you see the protests at the border against vaccine mandates and COVID mandates?
So maybe I'll ask Dr. Steen to comment on that, Dr. Mirage.
Well, it's very discouraging. I think for many of us in the community that have been working really hard in conjunction with all of our partners to battle this pandemic for the last 2 years, and we follow the science, we follow the data, we follow our public health recommendations. The idea of just throwing it all up in the air and kind of walking away from the science and everything that we've done, I think is very discouraging. I think people, again, just what Dr. Nesathuri just said, I think people lose sight of we're in this. We have to be in this as a community, and it's not just about me or him or Dr. Mirage. It really is about all of us looking after each other. So, I feel like that's what we do as Canadians. So I do find this a little discouraging on a personal and a professional level.
Dr. Mirage?
So I would have to say the same, and I think we have to try and understand where a lot of this is coming from. And I suspect that one of the major causes is the widespread disinformation. And as physicians, as the medical community, as family doctors, we are uniquely positioned to help overcome this disinformation, misinformation. In my experience in office, I often have patients who come in for unrelated issues. Of course, with every patient who we see, we inquire about vaccination status. In 95% of the patients who are unvaccinated, when you take the time to inquire further, it's because they have these misunderstandings. Some of them are very easy to set straight, and some of them, it takes a discussion because they subscribe to some of these, thoughts and theories about what the nefarious intentions of government may be. There's all sorts of theories, some of which are, quite extreme. But again, in 95% of the patients, if you speak to them in a non-judgmental manner, if you validate their concerns, and if you simply explain them away by providing the science, people they're actually quite grateful by the time they leave, saying, thank you for providing this information, for clearing this up, for putting my mind at ease, and I will, absolutely be happy to take this vaccination. So misinformation is a big deal, but yes, it is very discouraging to see what's going on out there. And I think it is our collective responsibility to do our best. We are all in this together. We all want the mandates to be done. We all want a return to normal life. And how do we get there? We get there by playing our part. Thank you.
So I share the perspectives of Dr. Steen and Dr. Mirage. Just a few thoughts, if I could share them. In medicine and in the public health service, we're trained to try to understand why people may object or disagree with the treatment plan that we have proposed as doctors. And that's something we do every day. The second item is that we welcome dialogue, so long as that dialogue doesn't become disruptive. And at this point, I think we've had disruption, and that concerns me a great deal. One point that we want to make, and I think as all doctors, is that every medical treatment has risks and benefits, and we have to make clinical decisions and public health decisions based on the risks and benefits. And in this particular case, the benefits of getting vaccinated so exceed the risks that we recommend it strongly. The other thing to think of is most of the people, the disproportionate number of people dying of COVID are people who aren't vaccinated. And so when we reach out to unvaccinated people to encourage them to get vaccinated, it's because of the affinity to those individuals. We want them to have good health. I was talking to an ICU colleague of mine just last week, and when we see it in our own records, many of the deaths from unvaccinated people are senseless deaths. They're people that would have lived many, many years and been with their families. save for the fact that they got COVID. So, in a nutshell, I think that from my perspective is that we don't want disruption in our culture. We welcome the dialogue, but we really, I personally am very concerned about the level of disruption this has created.
Thank you.
We will take questions from the Windsor Star.
Yes, good morning, all. Dr. Steen, Dr. Mirage, thank you for joining us today to answer questions. Based on the age-based breakdown of vaccination in our community, it's clear that parents are vaccinating themselves, but not vaccinating their young children. I'm just wondering what you may be hearing from your teams, from patients, about why they're slow to or hesitant to get the vaccine for those younger children.
So perhaps Dr. Mirage can comment, and then Dr. Steen.
So, that's a great observation. When you look at vaccination rates overall in Windsor, we are doing really well in the adult and, the teen population. And there is that absolute disconnect between the rates in that population versus the rates in the 5 to 11. And I think it comes back to reluctance, concerns about safety. I think initially, there were some thoughts about COVID not affecting the younger population as much as the older population. And the science does absolutely not support that theory, especially with the Omicron variant. We've seen that there's been widespread infection in children. And beyond that, we've, in our international experience, we've seen that the hospitalization rates in children were tremendous as well. So it is, again, that concern and reluctance because they're younger, and it comes back to safety, benefits outweighing risks, which again brings us to speak to your healthcare professional. So we know for sure that for the most part, these are parents who are most likely, I would use the term sitting on the fence, because they recognize the benefit of the vaccine for themselves, and they just need to be nudged and educated and reassured about the importance of and the safety of the vaccine in the 5 to 11 age group. And, one of the anecdotes I use in my office is that I would not recommend anything to my patients that I would not recommend for a family member or a loved one. And I have an 11-year-old, and as soon as it became available, we were first in line to have my 11-year-old vaccinated. And that's the highest and strongest testimony that I can give with respect to believing in the science, believing in the safety and the importance of the vaccine. Thank you.
So I would agree with everything Dr. Mirage has just spoken to, and I would say that a lot of it does come down to confidence. And this is not new. This is something we've seen. I've been in practice for 30 years, and we saw this when the chickenpox vaccine came out in the late 90s. There was hesitancy. People, they just exactly what Dr. Mirage said. They sat on the fence. No one even hesitates to get that shot now, but at the beginning there was that nervousness. It was the same thing with the HPV vaccine. When it was introduced for the grade 7 and 8, that hesitancy at the beginning, that nervousness around the shot. But again, it's the confidence. It's seeing that the science is proving true, that the risks, are far outweighed by the benefits. So I think this is a natural thing that as family physicians we have seen. And as Dr. Mirage said, it's conversation, and improving the confidence to move parents slowly along to believe that this is in the best interests of their children.
That's great. I think that captures my perspective as well. So perhaps we can go to the next question.
That's all. Thank you.
Any follow-up questions from CTV?
No, thank you.
Any follow-up questions from the Windsor Star?
No, thank you.
All right, everybody, we thank our guests very much, Dr. Mirage and Dr. Steen, for taking the time out of your day to join us. We will reconvene on Monday, February the 14th with our usual media briefing. Thank you all very much and have a wonderful Thursday.
Thank you.
Thank you.
All the best. Thanks, Dr. Mirage, Dr. Steen.
Thank you for having us. Bye.